So mental health is a vital part of an overall well-being, and it's the way we think and we feel and behave in response to life's challenges. And throwing a light on this topic, we have Dr. Sara Zaidi with us. She has completed her training in medicine and thereafter she did a master's in psychology and is now a licensed mental health counselor. So over to you, Dr. Sara, for
Thanks.
mindfulness and mental health.
Thanks, Sonia. I've got my video off, but if you guys prefer, I can put it on as well. But I'm going to get started. So Dr. Tareq and I are sharing time today. I will talk about what mindfulness is and how it works. And Dr. Tareq is actually going to talk about how to implement it. So much more practical. So let's get started. So first, just a very basic, what is mindfulness, right? And so these are, the first is a definition from the American Psychological Association, which says that it's a practice that promotes a psychological state of awareness and acceptance. Or in simpler terms, it's paying attention to present moment-to-moment experiences with an openness and curiosity, as well as a willingness to be with just what is, rather than trying to fix the problem. Right? And we will see in a few minutes why this is said to be better than trying to problem solve right away. Now, what is the relationship of mindfulness and spirituality? If we think about it, right, mindfulness really it involves a heightened state of awareness and consciousness in one's daily life and spiritual practices. So it's a conscious state of comprehensive awareness of a higher being and our inner state in relation to him, right? So creating a reciprocal relationship. We all submit to the will of a higher being in its complete form, and that mindfulness is considered to be the highest spiritual form attainable. Now, this is a practice that has often been associated with Eastern traditions, deeply rooted in various cultures, various religions. For example, Buddhism, right, teaches that what we want to happen versus accepting what is happening is what causes suffering. What we're doing with mindfulness is accepting what is happening. So in Sufism as well, for example, we think of zikr, which is, mindfulness is central to achieving a closer relationship with God, often through meditation. Yoga is another really, old ancient practice that incorporates mindfulness. And I just want to touch upon the word al-murakkaba, which is derived, which in Arabic is considered a virtue of Islam. It's derived from the root meaning to watch, observe, and closely consider. And it's deeply embedded in the teachings of of the Quran and the Hadith, where Muslims are encouraged to reflect deeply on their actions and their thoughts. And so we incorporate this in various forms and religions through fasting, through prayer, right? To self-reflect and to allow for spiritual growth. So this is not a new concept, is what I'm trying to say. This is a new word given to a very old concept. And I'll talk about why that's needed as well in a little bit. How did it move from these ancient practices to the West? There was a professor at University of Massachusetts, John Kabat-Zinn, who brought it to the West in the 1970s. He was a professor who had trained under Thich Nhat Hanh, who is a Buddhist teacher. And he developed a program called mindfulness-based stress reduction to treat chronic pain. What he discovered was that patients would often try to avoid pain, but that avoidance would actually lead to deeper distress. Practicing mindfulness actually had much better outcomes. And so then from there, it shifted into mainstream science and medicine, and it became a very pivotal therapeutic technique. It's the buzzword these days, really, and it's incorporated in dialectical behavioral therapy, DBT, cognitive behavioral therapy, ACT, which is the most latest acceptance and commitment therapy. And that's how we have brought it here, and it's become a concept that's now being used very often. So what is the psychology behind mindfulness, right? So to understand this, I want to explain, we need to look at why it's necessary, what's happening in our mind. So mindfulness assumes that there are three domains of human consciousness. The first domain is the experiential domain. What we experience from the moment we wake up to when we fall asleep, right? So what our experience through the day is. The second domain of human consciousness is our inner self, which is the internal narrator. It provides the story for what we're doing, given our self-concept, our understanding of our situation, as well as our worldview. And the third domain is the public persona that others see, what others see of us through our words and our actions. Now, in addition to these domains of consciousness, we have to look at how they work with each other, right? How they interact, how these domains interact with each other, with what we call filters. So the first filter is, as we said, experiential domain, right? From when we wake up to when we go to sleep, what's happening around us. And within this experiential domain, the attentional filter is what decides what we choose to notice, what we tend to focus on, and what stays in the background. So now consider this, right? Our brains are negatively biased. That's how we are. We are born that way because if you think about it, as primates, essentially, if there's a predator, you have to assume the worst, that this predator is going to attack you. And so naturally, there's going to be a negative bias in that situation, right? And we haven't evolved from that much, unfortunately. Our brains have not in that sense. And so we tend to focus on the negative aspects of things much more often. So let's take an example for somebody, there's a project at work that you really, really want to do. You'll get your name on a paper, you want to do all the research, you're very excited to work with this person, but it gets assigned to somebody else. And so instead of thinking about why we may not have gotten that project, maybe this other person was more qualified, we didn't have enough experience, we tend to focus on the unfairness of it. We focus on why we didn't get it instead of why the other person might have gotten it. That's the attentional filter, right? The second filter is what is called the Freudian filter because it utilizes defense mechanisms identified by Freud. And it connects the experiential domain, what we experience, and our inner self. Our inner self, which in psychology terms is also often known as the inner critic, is the narrator that uses defense mechanisms to alter and filter our experiences to make us feel better. So defenses like avoidance, suppression, or cognitive dissonance, where basically, you try to tell yourself a story that justifies whatever action we've taken or whatever decision we've taken. So let's continue with the example of the work project, right? And you may, if you don't get that project, you may push it away, you may avoid thinking about it, or you might start telling yourself, oh, you know what, I didn't have time, I really didn't want that project. So we are not dealing with it, we're just postponing it, essentially. And it may show up in a different way. So if you think about, in a very simple, basic biology terms, if you think about an action potential, right, that gets started, it's very difficult to stop an action potential when it starts, unless, of course, it's the chemicals don't add up and it doesn't meet that criteria. But it's the same thing. Once there is something in our body, it has to kind of go through for it to dissipate. And so using these defense mechanisms, it's just delaying the inevitable. And then the third filter is a Rogerian filter. It's just called Rogerian because based on a counseling theory where the idea is that we must approach all of our patients, everyone we interact with positive regard. And this filter connects the inner self and the public person, our public persona, in terms of how we want them to see us. So how we choose to portray ourselves, what we try to keep from others, either directly or indirectly. So sometimes we could be deceitful, or we might not share the complete truth. And for example, again, with the work project, if we continue with that, some other colleague comes or a friend comes and asks, oh, how come you didn't end up doing that research paper? You really wanted to do that, or that project, you really wanted to do that. And we might say, instead of saying that, oh, I didn't get it, we might say, oh, you know what, I just didn't have the time for it, so I didn't pursue it. So we are telling a different story because we don't want the other person to think that we didn't, that we weren't qualified or we weren't good enough. So But if we just were to go back and think about it, right? There's the experiential domain, there is the inner self, and there's the public persona. And these three filters are interacting between those three domains. And what happens is, as these three filters are working in our bodies and in our memories, more memories are avoided and split off, right? Like I said, we're delaying the inevitable. And an individual psychological state becomes increasingly destabilized, vulnerable, insecure, and defensive. And it can get to a point where any event or any anything can trigger a thought, a feeling, or a memory that we are trying to avoid. And so if these triggers are constantly present in our environment, that might result in chronic anxiety, in defensiveness, insecurity, lack of focus, and over time depression. So mindfulness, on the other hand, encourages acceptance, right? So it's trying not to avoid it, it's trying to approach it with a willingness and a curiosity and an openness to want to understand what's happening. So again, if we were to take the project situation, right, acknowledging to ourselves that I'm upset about this, I'm angry, I'm resentful, maybe I'm frustrated, and recognizing that perhaps it wasn't fair, and just being with those feelings rather than trying to solve the problem or trying to justify it. So bringing awareness to those feelings and how the body reacts, whether you're feeling palpitations in your chest or tightness in your shoulders, dryness in the mouth, which often happens when you can't speak up. Let those feelings pass instead of letting them simmer and let them simmer and build up inside. Okay, so it creates mental harmony, essentially. Now that I know is a lot of information, so I'm hoping you're absorbing it. But if there are questions along the way, Sonia, if you could bump them to me, or we can wait until the end as well. But what I want to, I think this is, so what are the, I'm going to go back to, what are the mental health, briefly, I just want to touch upon the difference between mindfulness and meditation, and I'll come back to the mental health benefits in a second. Mindfulness is a little bit easier. It can be done anywhere, anytime. You're present in the moment. You're open and accepting. Meditation requires you to be seated. It's a little bit more formal and time structured, requires a little bit more training to seek that state of inner calm and consciousness. I'm going to skip this and I'll come back to that. So when you consider mindfulness, what it does is that it reduces stress, anxiety, and depression, and it improves focus and memory. So remember where I was talking about the attentional filter, the defense mechanisms, and how we want others to perceive us? Mindfulness intercepts those negative pathways, right? And it's also actually, as we said, Dr. Zinn actually did that MBSR treatment to show that it decreases chronic pain. The mechanism through which it works is through self-awareness, attention control, and emotion regulation. And MRI studies have shown how the brain changes after practicing mindfulness. The image on this image is, it's not very clinical. I wanted to keep it simple. It's a very simple illustration of the areas of the brain that are activated when our mind is wandering, which is the left one, which is all the colors. And after mindfulness, the only activation we see in the prefrontal cortex, which is the bottom picture, right? Just a little blue. So see how it kind of, brings focus. So the brain is not in chaos. It's not overwhelmed. It's much more focused. And more specifically, MRIs have shown that, the parts of the brain that actually have shown changes. The anterior cingulate cortex, which is associated with the ability to shift attention, has a higher gray matter density. The amygdala that we know is central in the fight or flight response shrinks in size. The prefrontal cortex, or the logical part of the brain that is responsible for executive functioning, such as planning and problem solving, has increased gray matter density. And the connections between the amygdala and the prefrontal cortex are strengthened, paving the way for higher order functions to be strengthened and resulting in less emotional reactivity. Also, in terms of chronic pain, researchers have found that meditation-induced pain relief is associated with the deactivation of part of the ventromedial prefrontal cortex, right? So all of these MRI results are consistent with the central idea of mindfulness, which is to experience thoughts and sensations without attaching our sense of self or our ego, actually alleviates emotional pain or discomfort. Okay. So let's talk about the benefits for health professionals. Now, a team of researchers led by Dr. Berger a while ago in 2017, they did a mindfulness program they conducted that to show that mindfulness could improve the mental well-being of healthcare workers at an NIH clinic. So they ran a 5-week program in which participants attended one 90-minute mindfulness training during the workday each week. The classes were led by clinical psychologists and a mindfulness instructor. And the study showed that the stress level and the anxiety levels of individuals that participated versus those that were on the waitlist program was significantly lower. And what was more interesting is that the benefits actually persisted for 2 months after the program ended. And at that point, people were more inclined to do mindfulness practices on their own as well. So the results of this study indicated that a structured 5 to 6 week mindfulness program has the potential to benefit clinicians by reducing emotional reactivity and also professionally by promoting deep listening and communication. So this is where we see, the patient, the health professional, the patient relationship improving, because the ability to stop and reflect through mindfulness is associated with an improvement in the ability to listen and communicate. So observing and describing, essentially, right, very basic counseling therapy skills have actually improved active listening and empathy, allowing for a much more positive and a compassionate communication with the patient and the family, especially when it's a very difficult case. Similarly, the reduction in emotional reactivity that we talked about, right, with the brain changing just by being more aware and pausing and slowing down, allows the person to provide much more thoughtful guidance. So the counseling skills are improved. So rather than reacting to a situation, you're able to pause, you slow down, you're giving them much more thoughtful guidance, you're listening to the patients. Additionally, non-reactivity also contributes to emotional resilience. Because then you're not getting carried away, you're not getting all stressed out. And that is directly related with burnout. So it protects against burnout. And finally, mindfulness can also reduce stress and anxiety because we're making less errors, less mistakes by managing distractions and heightening our focus as we do the work. Okay, so as you guys are all faculty, I just wanted to also talk about what is in it for you? Why is this beneficial to you as teachers, as professors, right? So what we try to do is we try to do we do our lessons, we plan our classes, but what we can have a much more effective learning environment by learning to manage our emotions, our reactions to things, instead of trying to control the students in our class or manage their behaviors, right? So we may have a lesson plan, we may have an expectation of how we want it to go. And what we might be focused on is what we need to do rather than sort of how things are going in the present moment. And if we were aware of this, we could manage our own expectations and we would be less anxious as teachers, right? And similarly, we might want to get through our agenda, our lesson plan, but slowing down and deliberately pausing for a moment can give us time to ask ourselves, what's going on? What's happening in the classroom? What do my students need right now? And we adapt to the situation. So in a virtual class, for example, right, if you're getting a lot of questions in the chat, or somebody is like raising their hand and you're not able to, think on your feet or respond or adapt your lesson to that, then we're actually doing a disservice to our students. And so we want to be mindful of how we're teaching. So even something as simple as setting up the classroom, obviously, if you're in person, I mean, I like these U-shaped classes, which is much more discussion-based than what we were used to growing up, right? Like seated in rows and just being lectured at, which is kind of what I'm doing to you right now, but it's much more interactive. And in a virtual environment, knowing what tools we might have, right? Like Zoom, for example, has a whiteboard. We can use videos. We can use the chat option. We can use the Q&A. So trying to promote an environment which is much more positive than what perhaps we were raised with, and just being aware of all of that to allow for enhanced learning. Now, I think the most important thing perhaps might be recognizing our responses towards students. So I teach a couple of courses at universities here, and it's very interesting, if somebody walks in late, or if somebody is not paying attention, or if somebody is being argumentative, we tend to personalize it a little bit. And so if instead, right, we were to look at why the student might be behaving that way, what's going on for them, we might be more understanding and we might respond to them in a more appropriate manner. So, for example, if we're feeling annoyed, we try to look at what's going on for us. It might be that the behavior is attention seeking. Or if we're feeling threatened, maybe the behavior of that student is that they want to take over the class, that they're seeking power, right, in the classroom setting. We do have students like that. Or if we're feeling discouraged, maybe the student is giving up and we are personalizing that it's our failure as a teacher. And so if we recognize what's going on for us in response to somebody else, we can respond more appropriately to the underlying issues that our students might be struggling with. It's very similar, I do a lot of parent trainings as well, and it's very similar to a parent-child dynamic, right? We often think about what's going on for us in a selfish way, instead of thinking what might be happening for the child. And so if we were to focus on the child, I think we would react a little bit more slowly and more positively than perhaps we otherwise do. And then finally, giving each student our mindful attention for even a short period of class time. Because so that you have that touch point, right? Especially virtually, it's even more important to let the student know, I see you, I know you're there, you're making an effort. You could do that again via chat. You could write, when you send them back their coursework online, you could put a note on there. But recognizing them acknowledges to them that my teacher knows I'm here, I'm of value, I have importance in this group dynamic. So that's all really important in creating a positive learning environment. I'm going to go back to specific techniques. I can't see the chat, but I'm hoping that so far you guys are with me. We're like I said, I'm providing just the basic introduction of mindfulness. It is what it is, and Dr. Tareq is going to go into sort of how to implement it. But I did want to share some very basic techniques of mindfulness, right? Like I said before, right? In our religious, cultural, spiritual practices, we are doing this regularly through prayer, through fasting, through reading holy books, all of that. But on a day-to-day basis, why does this even become necessary, right? Like there's something called the popcorn brain, which didn't exist before. This is a new term, and it's because of our iPhones, right? We have a hard time waiting in line without pulling out our iPhones to do whatever. We just don't have the patience or the quietude in our mind anymore to stay focused. Like we, for example, again, we didn't have video screens in our cars when we went on drives anywhere. I mean, we used to spend, we joke about this. We used to spend an hour waiting for our sister outside of her school, but when my brother and I got out. And that, I can't imagine my children doing that without having a tantrum, right? The world has changed. It's become much more fast-paced. And what that's done to us is that our brain then doesn't have time during the day to process everything that it's experiencing. Remember the experiential domain, right? Everything that it's experiencing. So when we get to bed at night, our brain doesn't necessarily shut off. And so we have racing thoughts, and as we've seen, the levels of anxiety, depression, even functional depression, you're working, but you're feeling there's a lower level of dopamine in there are high levels of cortisol and lower levels of natural dopamine. We're getting dopamine hits from Instagram or from emails or from WhatsApp messages. But we are, overall, our mental well-being is not doing so well. So mindfulness is just, again, an old, it's a new term for old practices. So grounding is a very simple technique. And I'd like you all to consider doing this as I'm talking and just see how it goes for you, right? Grounding is, again, another buzzword. Literally, the idea is ground yourself in your environment. So wherever you're sitting, right? Just lean back into your chair. See how it feels to be supported by whatever you're sitting on. Feel it on the back of your, on your back, on your legs, your feet touching the ground. Where are your hands? Be a little bit mindful of where your body is, how it is placed in that environment, right, that you're in. And just sink in. Just sink into whatever it is you're sitting in and allow yourself to just relax and notice through your five senses how your body is feeling. That's a very simple, basic thing. And then notice the breathing. You notice your breathing. Now, that's a meditation technique as well. But in mindfulness, all we do is just, it's not like breathe in, breathe out, but that's just something as you're grounding yourself, as you're focusing. It's a very easy way to find a rhythmic balance. So something even like if you put your hands on your pulse and your fingers on your pulse, and you just allow yourself to feel that and notice that, even that can be calming in itself because our heartbeat has, there's a regular rhythm there. Another really quick exercise for grounding, it's a fun game that I sometimes play when I'm doing trainings, is 5, 4, 3, 2, 1. So 5, 4. So I want you, all of you, very quickly, I'm going to give you guys seconds, right? I want you to identify 5 things that you can see. Say them out loud to yourselves. 5 things you can see. 4 things you can touch. 3 things you can hear. 2 things you can smell. And 1 thing you can taste. Maybe it was the last thing that you had for breakfast or lunch or whatever. And notice as you did that, were you distracted by anything else? Probably not, because we were engaging the prefrontal cortex, which is the executive functioning, right? And so it was logical game. There's no emotion there. And we're bringing ourselves to the very basics, right? Another game simply is count backward from 100. And when I do these trainings with lawyers and doctors, I often have them stand up and be like, okay, count back from 100 minus 7 all the way to 0. And they think they can do it and they always stumble. And it's actually really funny because, it helps them see how this is beneficial. And as we do all of these, right, like even something as simple as listening to a surah or a mantra, whatever it is, rhythmic sounds, what that does is it reduces cortisol, right? Because it is taking away distractions and it's increasing the natural levels of the good hormones, the norepinephrine, the dopamine, but it's reducing the sort of the unhealthy chemicals in our body. It's dissipating those. Another exercise is the balance beam, what we call the balance beam. And it's so simple. If you go for a walk, right? I mean, most of, muscle memory is a thing. Like you probably don't remember how you get home from work, right? You just get out of the train station and you walk home and you're not really thinking about where to turn or which light which street you need to turn on. What we want to do is we want to notice things around us. So imagine you're walking on a balance beam and you need to stay present. And so notice everyday things, right? Maybe count the number of traffic lights that you do cross, or look at the street vendors and see what they're selling. Notice the different colors, notice the different smells coming from the various shops. Notice all of these things, count the number of dogs being walked. Something really simple, but again, bringing your attention back, paring it down, letting the distractions fade away and just being. And another thing is the body scan. So like I said, when we were talking about the project not being assigned the project that we really wanted, and I said, notice what's happening in the body, right? Notice if you do a body scan, you know how we go through the airport and there's a scanner and it lights up if there's, if you're wearing a metal chain. So in the same way, you do a body scan for yourself and you see where it might light up, and you don't have to identify it. You can just notice, oh, okay, my heart is beating faster than usual, or I'm a little bit sweaty, or I've got a little bit of tightness in my jaw or my fist or whatever. You just notice it. There's nothing to be done, which is counterintuitive to most of our medical scientific minds. It's like, okay, come on, there's a problem, let's solve it. But the idea here is if you let it be and you're just curious about where is this coming from and just slow yourself down, it will subside. Because the body cannot for long periods of time sustain that level of stress, right, without breaking down. So you just you give it attention and you move it away. One exercise that I do with the body scan is, especially because I work with kids, is like, listen, let's notice what's happening. Take a Sharpie, take a marker, and see if you can circle it, imagine it hypothetically on your body. And then move your attention away to a part of the body that's not feeling tense or stressed. And then bring it back. So if you guys try this, if you notice this, that maybe you're feeling tired somewhere and you give your attention to the shoulders, they're slouching down, and then maybe you wiggle your toes a little bit. You'll see that when you go back to your shoulders, it feels a little bit better. Another really simple exercise that I want you guys to do, which is how mindful actually was demonstrated initially in the West, was mindful eating, right? Food is such a big part of all of our cultures. We gather around it socially. We do a lot of things. It brings families together, all of that. Especially our food is very aromatic and colorful. What I want you to do is just take one bite. And they did this with a raisin. You could take any small thing, and I want you to just put it on the palm of your hand, look at it, describe it with your five senses. Look at the texture, the color, the smell, whatever, however many adjectives you can use to describe it before you eat it. And then when you eat it, bite it at least, a dozen times, chew it a dozen times before you swallow it, and see how enhanced that flavor is at that point. And so the mindfulness then becomes, it's just doing everyday things in just a more pronounced way. And again, it would not really be necessary if our brains were not as chaotic as they have become. This is something that's been happening for a long time. Like, for example, like I said, we do this on a regular basis. So, so I wanted to just do a recap of what I've talked about. I talked about what mindfulness is, the psychological state of awareness and acceptance. The difference between meditation and mindfulness is very slight. Meditation is a way to cultivate mindfulness, right? I talked about the origins of mindfulness in the East and how it came to the West through ancient practices, and then how it was, the clinical studies were done. And then the three domains and the filters that are negatively biased, and mindfulness actually intercepts those filters to give us a more productive, more healthier approach to things. And then, of course, the benefits for teachers and for health professionals. And so I think I'm good. And then I just want to conclude, because I want to hand it over to Dr. Tareq to add more details. But what I'm going to conclude is, like I said, mindfulness is really just a new way of looking at age-old practices. And very, very, very simply, it is a way of accepting and being at peace with oneself that improves overall well-being, reducing stress, anxiety, depression. It's just simply being at peace. Like, think about when you're praying, when you're actually focused, how peaceful that can be. Or when we go to spiritual places, how peaceful that can be. That's what this new age concept really is. It's just a buzzword. It's what we've been doing forever. We just want to be more conscious of it. We want to incorporate it into our daily lives. We want to bring it to the people we work with, because MRI studies have shown that there are significant improvements through mindfulness that come about. So that was my introduction to mindfulness. Thank you, guys.
Thank you, Dr. Sara. There was a question from Zaidi, sir. Can
Mhm.
you identify the neurochemicals released during mindfulness, particularly during tasbih and zikr?
Yeah, so it's usually dopamine, serotonin, and GABA, right? Those are the three main ones, which is similar to all, I think, mindfulness practices, because through both of those, just looking at the chat, through both of those, again, you're calming yourself down. It's rhythmic. Rhythmic is what's important. You're paring everything down. You're focused. You're bringing your attention to it. And those are the three main and of course, cortisol is reduced. I hope that answers it.
Yeah. Any more questions from the participants? Any questions from the participants? You can unmute yourself and ask the question. I guess there are no other questions. Thank you so much, Dr. Sara.
Absolutely. Thank you.
We shall now move on to Dr. Ali Tareq, who is a PhD in dermatology. He has a diploma in psychodermatology and diploma in psychotherapy. And his field of interest is phenomenology, which is a philosophical approach that focuses on the study of conscious experience or perception. That's very interesting, sir. Uh, let us hear from you. Thank you.
Thank you. Assalamu alaikum. Thank you, Dr. Sonia and Dr. Sara, for giving me opportunity to share with you my thought about mindfulness and its application in my medical education and in our Islamic tradition. My presentation is about 12 tips for incorporating mindfulness in medical education. Apologize me for I will use Arabic language because most of audience are Arabic, and we can get benefit from these two language. فمحاضرتنا هي عن استخدام اليقظة الذهنية في التعليم الطبي. بالحقيقة هي المحاضرة راح تكون تطبيقية نوعا ما، بها ربط بين اليقظة الذهنية والقرآن والتعليم الطبي وحدث أهل البيت. Learning outcomes. At the end of this lecture, you will be able to define mindfulness and its opposite, describe it as Islamic virtue, and design mindfulness-based medical education curriculum. We start with John Wolfgang von Goethe. He said that the hardest thing is to see is what is in front of your eyes. This quote is very important to understand the phenomenology of mindfulness. We start with this map, mindfulness, why mindfulness, and what is mindfulness, and how implemented, and who can embody mindfulness. Dr. Sara speak about what in details, so I will skip some slides if there is a similarity. Why mindfulness? لماذا نحتاج اليقظة الذهنية في هذا العصر؟ في الحقيقة هذه العبارة ممكن تفيدنا. هي أحد السايكولوجيست سيد محسن فاطمي in a book Therapeutic Application of Langerian Mindfulness. He says, most of us seem to be mindless most of the time. No matter what we are doing it mindlessly or mindfully. And the consequences of being in one state or other is consequential for our health and well-being. In fact, it seems to me that virtually all of our problems, personal, interpersonal, professional, or even global, are the direct or indirect effect of our mindlessness. This is very important quote or statement. What Holy Quran says about mindlessness, which is, as Fatimi says, it is the origin of evil in this universe. Quran said, بسم الله الرحمن الرحيم ولقد ذرأنا لجهنم كثيرا من الجن والإنس لهم قلوب لا يفقهون بها، ولهم أعين لا يبصرون بها، ولهم آذان لا يسمعون بها، أولئك كالأنعام بل هم أضل، أولئك هم الغافلون. In English, and we have certainly created for hell many of the jinn and mankind. They have hearts with which they do not understand, they have eyes with which they do not see, and they have ears with which they do not hear. Those are like livestock, rather, they are more astray. It is they who are the heedless, in our language, mindless. Professor Richard Davidson in TEDx lecture says there are 4 challenges facing society. In his lecture about mindfulness change the emotional life of our brain. First problem is distractibility. As you know, we are distracted by social media, by life challenges. So we are most of the time not in the present. We are distracted to the future or the past. So 47% of people, most of the time, the average American adult, not paying attention to what they are doing. ADHD in the rise, which is regarded as the diabetes of psychiatry, as if diabetes of psychiatry, because it is on rise due to this problem. Loneliness, which is also a major problem of absences, absencing from the present. 76% of middle-aged Americans report moderate to high level of loneliness. Negative self-talk and depression, as Professor Sara says, which is a negative consequence of mindlessness. Loss of meaning and purpose in life. Lack of purpose predict an early death. In a study, people in their 60s with low purpose in life are over 2 times as likely to die within 5 years as those with high levels. So this is very important issue. Each of these challenges impact the mind and the brain and physical and mental health. The 4 pillars of a healthy mind, as Professor Davidson says, are awareness, connection, insight, and purpose. These are 4 pillars of a healthy mind and healthy life. Mindfulness surely can foster these 4 pillars. So what is mindfulness? I will revise the definition as described by Professor Sara. Mindfulness, this is my definition of mindfulness, which is derived from reading in different contexts. Mindfulness is a mode of being that make religious, philosophical, and scientific experience possible. This is can be regarded as a hypothesis and can be confirmed by many studies about it in theology and in religious traditions, as says in the Quran. Kabat-Zinn define mindfulness as paying attention on purpose in the present moment in a particular way, non-judgmentally, to develop self-awareness. This is the definition of mindfulness. In Arabic, اليقظة الذهنية هو أنه انتباهنا يتوجه بشكل إرادي نحو الحاضر، لأن انتباهنا أغلب الأحيان ينتقل يعني نحو المستقبل ويولد لنا قلق، أو يتعلق بالماضي ويولد لنا اكتئاب أو حزن. فإذا اللحظة الحالية، اللحظة الحاضر، البريزنت، اللي هو الجفت اوف اور لايف، اللي هو الحاضر هو هدية أو النعمة أو اللي بالحقيقة بها نكون أونلاين. إحنا إذا كنا موجودين بالحاضر بشكل كامل راح نكون في حالة من الوعي الذاتي self awareness. بنفس الوقت نوقف الأحكام اللي هي تقيم دائما ما نراه بشكل جيد أنه هذا wrong أو right، صح أو خطأ، سيء أو جيد. فهذا الجادجمنت اتيتيود إذا كان موجود راح يمنع المايندفولنس. من المسؤول عن هذا الموضوع؟ بالحقيقة we are inside language. Our linguistic, our symbolic mode of being is a barrier toward mindfulness. So to be mindful is to be outside of the language, and this will be later on cleared. This is a quote from Rumi, which can explain the meaning of non-judgmental attitude. Out beyond ideas of wrong doing and right doing, there is a field I'll meet you there. When the soul lies down in that grass, the world is too full to talk about. Idea, language, even the phrase each other does not make any sense. This is summarizes the meaning of mindfulness. This is a picture in which the child mindful because he can see what is present in front of their eyes, while the adult, his mind full with many issues, which make them more suffering, while child living in the present more than adults. This is applicable also not only to the child. There is a picture which describes the animal, also more mindful than human adult. This is why in Quran says that the animal, we are more going astray than level-stick our animals. One of the leader of mindfulness is Ellen Langer, which defined mindfulness in a way is very important for us as educator. Langer says mindful approach to any activity has three characteristics: continuous creation of new categories, openness to new information, and implicit awareness of more than one perspective. This is what is the effect of being mindful. Also, she says, we do not enjoy our lives enough because we are not actually there. We are mindless, not mindful. She also says, life consists only of moments, nothing more than that. So if you make the moment matter, it all matter. Rumi says, this moment is all there is. Rumi usually summarizes what Western philosophy or Western psychology try to disclose. What is the opposite of mindfulness? We said mindfulness, the opposite of mindfulness is mindlessness, which is the autopilot, al-ghafla, بلغة القرآن. Autopilot is the opposite of being mindful, tendency to carry out tasks without being aware. And this is very important in our practice as a physician or medical healthcare professional. Most of the errors in our practice is due to mindlessness or the autopilot mode. It can be useful when we drive a car. However, we miss much of our lives in unawareness. And unhelpful thinking, cognitive errors, biases such as all or nothing thinking, generalization, self-criticism, and depressed thinking can also become automatic. Let us watch this video that can explain the effect of mindlessness and the effect of being mindful.
Every time I'm pulling out, he's right there. Man, someone needs to talk to his parents if they're ever home. What is a tragedy today? It's always, every day, this section's always crowded. I hate pulling out of here. I need someone just dumb road. Oh, there's. Okay, so I'm not even here. Right. Great lady. Princess of Park. Sure. Take this spot. Way to be considerate. Oh, kidding me? Unbelievable. Oh, thank you, man. About time. Let's see, what do I want? Yeah, can I add a cookie to that order? Yeah, no problem. Yeah, no problem, guy in the world. Sure you need your cookies. The world, your oyster. And he's serving you a cookie. Thank you so much. What can I get for you? Yeah, I'll talk decaf macchiato. Yeah, no problem. $3.85. And it might take a few minutes here. We've got quite a line, obviously, and thanks for your patience. Great. Yeah, great. Great for me. Winning again. Unbelievable. Right. What? What is that? What in the world? Oh, what? What am I supposed to do? How can I do anything about that? Can I even help with that? Oh, your coffee, sir. Oh. I can't take this anymore. I gotta get out of here. Hey, what? Hey, buddy, come here.
So in this video, we watch the paradigm shift from autopilot mode of being to mindfulness mode of being. And this is essential for development or emergence of empathy and compassion. This is why we say that mindfulness is a prerequisite for compassionate approach in medicine or in life in general. Imam Ali, alayhi salam, he has many quotes that fulfill the meaning of mindfulness. He says that الرجال أربعة رجل يدري ويدري إنه يدري فذلك عالم فاسألوه ورجل لا يدري ويدري إنه لا يدري فذلك مسترشد فارشدوه ورجل لا يدري ولا يدري إنه لا يدري فذاك جاهل فارفضوه ورجل يدري ولا يدري إنه يدري فذاك نائم فأنبهوه. Men are of four types. A man who knows and knows that he knows, so ask him. A man who does not know and knows that he does not know, so guide him. A man who does not know and does not know that he does not know, so reject him. And a man who knows but does not know that he knows, so wake him up. We need waking us up many times. And this is what is the meaning of this quote. Imam Ali said, "An-nas niyam, فإذا ماتوا انتبهوا." People are asleep. When they die, they wake up. So we need not to die to wake up. We need to wake up as we live now in this life. And this can be achieved through mindfulness. Imam Ali says also, don't allow yourself to feel sorrow for what you have lost, such that it preoccupies you from what is yet to come. This is the essence of therapy in using mindfulness, because those who are suffering in depression or anxiety, they lost the touch in the life or the present, because they are stuck on in the past or stuck on in the future. Imam Sadiq alayhi salam says, the one who acts without insight is like the one who walks on the wrong path. The speed of his walk only increases his distance from the path. صادق عليه السلام قال العامل على غير بصيرة كالسار على غير طريق لا يزدو سرعة السير من الطريق إلا بعدا. But then mindfulness is insight, and this is one of the definition by Richard Davidson. Is there an Islamic term for mindfulness? Professor Sara says that it is muraqaba. Mindfulness translated as muraqaba. Muraqaba, it is Islamic context, is the virtue of muraqaba, a word which is derived from the root meaning to watch, observe, regard attentively. Muraqaba necessarily include mindfulness of one's own intentions, thoughts, emotions, and other inner states. Muraqaba is observation of one's innermost being, al-sir. to be aware of the hidden with very moment and utterance. With every moment. This is an article about muraqabah as a mindfulness-based therapy in Islamic psychotherapy by Nazila. In Quran says, إن في ذلك لذكرى لمن كان له قلب أو ألقى السمع وهو شهيد. Indeed, in that is a reminder for whoever has a heart or who listen while he is present in mind. Muraqabah is to be devoted to the names of Watcher, Al-Raqib, the Guardian, Al-Hafiz, the Knowing, Al-Alim, the Hearing, Al-Sami', the Seeing, Al-Basir. Thus, whoever understands these names and is devoted to fulfilling them will acquire Muraqabah, which is mindfulness. Ibn al-Qayyim al-Jawziyyah. William Blake also noticed such a process of mindfulness when he says that when doors of perception are cleansed, men will see things as they truly are, infinite. Mindfulness in medical education has gained significant traction in the field of medical education as healthcare professionals recognize the benefit it can offer to both students and the practicing clinician, and Dr. Sara referred to them in details. This is a very important article in Medical Teacher, 12 Tips for Mindful Teaching. I recommend it to be read. And this is also the same journal, 12 Tips for Mindful Teaching and Learning in Medical Education. In abstract, we read this in short. Mindfulness practice has been shown to have many positive benefits for patient, clinician, and trainees. Mindfulness fosters compassion, connection, enhanced clinical reasoning, and can reduce burnout among clinicians. A primary focus of mindfulness is present moment awareness and may be achieved through openness, curiosity, perspective taking, letting go of judgment. How? In this review, we present 12 practical tips for effectively integrating mindfulness practices into medical education programs. First, adopting experiential learning theory called theory, which is grounded in phenomenology as a paradigm. It starts with experience and then reflection and then abstract conceptualization and then active experimentation. The primacy of experiential moment is the essence of mindfulness. This step can be gained only when we are mindful. So whole cycle start with mindfulness. Second, secure institutional support. I will read only the title of each tips to save the time. Secure institutional support. Led by example. Offer diverse mindfulness opportunities. Integrate mindfulness into the curriculum. Foster self-awareness. Emphasize the evidence-based educate students about the empirical evidence supporting the benefit. And Dr. Sara had talked about these evidences in mindfulness and the brain, in MRI. Provide ongoing support. Tailor mindfulness practices. Encourage peer support. Assess and evaluate. Regularly assess the impact of mindfulness initiative through survey, focus group, other evaluation methods. Collaborative with mental health professional. These 12 tips which can help us integrate mindfulness in our education system. Who are mindful? What happened to us when we are mindful? We can use Myers-Briggs test to know how to shift from mindlessness to mindfulness. In Myers-Briggs test, there is four categories of portrait: extrovert, introversion, sensing, intuition, thinking and feeling, judgment and perception. Mindfulness, it is practiced in this side, the right side, which is the introversion, intuition, feeling and perception. It is a kind of self-awareness. Perception means presence in the here and now. And this is the two hemispheres, right brain and left brain. Mindfulness practice through right brain, because to be mindful is to be outside the language. Language usually categorize things into right, wrong, into true, false, into 0, 1. So in this attitude, on this stance, we are usually in autopilot or in mindless state. We can use Maslow hierarchy to understand mindfulness, which is embodied when we are in the 8th stage, transcendence. Mindfulness is a state of self-transcendence. This is why we are become compassionate and empathic. Conclusion, there are two roads diverged in a wood, and I took the one less traveled by, and that has made all the difference. Robert Frost. So mindfulness, unfortunately, it is less traveled road in our education system. Thanks for listening.
Thank you so much, sir. Is there any question from the audience?
So, Ali Tareq, this is Dr. Zaidi. I have a question for you.
Yes.
When you talk about meditation, mindfulness, and medical education, what is more important in terms of application of these sciences in clinical practice, not teaching? I'm talking about clinical practice, like when you
Yes.
see a patient, for example,
Yes.
or mindfulness.
Of course, my professor, we are in everyday encounter our patient. Usually, our patients are concerned and worry, and they are afraid or fear or something in the future, or they are in something in the past. So usually they are absent from the here and now. The doctor need to bring the patient to this moment, to the here and now, and make them more self-compassionate, more acceptance to their condition. Rejection, the denial by patient most of the time make them outside of the present moment, and this is affecting the patient-doctor relationship and the adherence to treatment.
Right. So let me share an experience
Yes.
that I learned or gained from a certain teacher. There is a gentleman here, Dr. Lara, he's a very famous scholar. He
Yes.
has done research, I think in Cambridge or Oxford, on exactly what Sara was saying or what you were saying about mindfulness and the role of mindfulness in healing. So
Yes, of course.
they did a study on a cohort of patients who were normal and patients who had cancer. And,
Yes.
and there were believers and non-believers both, not necessarily Muslim, Christian, Hindu, etc. And they found out that with the MRI, like Sara was saying, there were certain active areas in the brain in
Yes.
the people who are meditating. And they
Of
also
course.
took out blood samples and found the various combinations of neurochemicals and neurotransmitters. So there is, I think the report is published, very, very phenomenal approach. They do on hundreds of patients. So my question is that do you use this in clinical practice? Because you are an
Yes, of
expert.
course. Of course, my practice as psychodermatologist, most of the time my patient suffering from skin problems, which are result of traumatic events, psychological trauma. So they are induced by stress. As you know, the stress effect on the body is well established association or correlation, and there is a psycho neuro immune model, a biopsychosocial model, or psycho neuro immune model that explain the correlation between stress and the immunity. So if we find a tool or a practice that help us reducing this stress, we can help patient recover or relieved and remission, get the disease, their disease remission as early as possible. And I have many patients suffered from psoriasis and eczema and vitiligo. Their well-being and quality of life dramatically changed when they practiced mindfulness.
Thank you.
Thank you.
Any more questions from the audience? You can also post your questions in the chat box.
السلام عليكم.
وعليكم السلام ورحمة الله. أهلا دكتور أريج.
السلام عليكم. عاشت إيدك أستاذ على المحاضرة القيمة. بس أنا عندي استفسار بالنسبة للمايندفولنس، هو نفسه ممكن نقول عليه الاستبصار؟
انسايت يعني قصدك الإنساء البصيرة؟
أي؟
يعني هو جزء من المايندفولنس. البصيرة هو أكيد شيء ضروري، يعني ما ممكن نمارس اليقظة الذهنية بدون بصيرة. فهي جزء من الموضوع، ولكن أهم شيء بالمايندفولنس إنه ما نندمج ويا مشاعرنا ويا أفكارنا، يعني يصير عندنا مسافة distance. There is a distance between our thoughts between us and our thought and feeling and experience. This is the important issue in mindfulness. Most of the time we are fused with our thought and feeling, and this is what makes us suffer.
تمام. لا يعني قصدي الاستبصار يعني.
الاستبصار إذا if you mean the استبصار in بصيرة in وعي يعني self awareness, surely it is a part of the process of mindfulness. Surely.
تمام. تمام. شكرا جزيلا.
شكرا دكتور أريج السؤال.
Thank you, Dr. Arij. Any more questions? You can also post your questions in the chat box. I suppose there are no more questions.
أعتقد I think we need to know that mindfulness اليقظة الذهنية nowadays it is introduced in the preschool and in primary school and secondary school and in the college as important program, because we are, as I said in the first my lecture, there is a challenge of distraction. Most of our children and most of our youth are distracted by social media and by many issues, and this is what explains the high percentage of high prevalence of suicide and depression, anxiety. So mindfulness is like a vaccine. I think we need to deal with it as a vaccine, a protection from such issues. If there is a question about how to practice my mindfulness in my everyday life, usually we think that mindfulness is a meditation practice and need specific conditions, a special condition. اليقظة الذهنية بالحقيقة ممكن نمارسها من ناكل when eating, mindful eating. لذلك for this reason it is used for people with eating disorder. We eat without awareness. So paying attention to what we eat in details and what we taste and the texture of what we touch. This is one of very simple technique to use mindfulness, to be aware of any activity we do, like washing clothes or dishes, like washing our teeth, brushing, any activity like walking. Any activity can be used as a medium for mindfulness, because mindfulness is to be aware of what we do, reflection on what we do, not just reflection on our thoughts or our feeling. Our actions are important to be mindful, and this is called reflection practice, which is very important to reduce errors and reduce many issues which are collateral damage can be happen because of such unawareness.
Thank you so much, sir. Any concluding remarks from Zaidi, sir?
Well, I thoroughly enjoyed. I mean, Dr. Sara's lecture was very intuitive, absolutely wonderful in terms of giving information about the basics and fundamentals of mindfulness, and Tareq applied in clinical sciences as well as medical education. Very thought-provoking, very intelligent lectures, both of them. And I think hopefully we'll be able to learn a few things from their lectures, these scholars. Thank you both, Sara and Tareq, and please come again in the future of Sadiq International Virtual University. Over to
I think, thank you, Dr. Shabi. I think there is a comment from Dr. Ala. Dr. Ala, she said, the Prophet says, Rabbi arini al-ashya kama hiya. I think this is best to finish our lecture with it.
of course.
Rabbi arini al-ashya kama hiya. This is the essence of mindfulness. It was to see the things as they are, not as we are.
Okay, that's the meaning of it. See the things as they are and not
Yes.
as they appear to be.
Yes.
Okay. Well, thank you so much. And with Sonia, you want to conclude, Sakia, Sonia?
Yeah, thank you, sir. So, with this lecture, we now come to know that mindfulness is the practice of being fully present and engaged in the current moment while cultivating a non-judgmental awareness of one's thoughts, feelings, and bodily sensations. And it also involves paying attention to the present moment with openness, some curiosity, and willingness to be with what it is as it is. Thank you, sir.
Thank you. Thank you for this summarization.
With that, I think we can conclude the session. Thank you so much. Thank you, participants. Thank you, teachers, educators. Thank you, and see you again. Bye-bye.
Thank you.